Do all tummy tucks come with a muscle repair? So the classic answer is yes. And the best way to explain that is first to explain what do you do in a tummy tuck. So a tummy tuck classically is when you make a long, low, horizontal incision in the lower part of the abdomen. You make a tiny little incision around the belly button because the belly button stays attached to the muscles of the abdomen underneath it. You take the skin and the fat, you lift it up off the muscles of the abdomen and dissect all the way up to the rib cage. Once you do that, you're looking at those vertical six-pack muscles that used to be pulled together, but after pregnancy, weight loss, whatever, they're often stretched apart. So that's when we will go and tighten those six-pack muscles together to both cinch in the waist and flatten the abdomen in the front. Once we do that, we take all that extra loose skin, we pull it all the way down and cut out all the excess loose skin. Doing that takes that little hole that we used to have for the belly button, takes it down, and often either cuts it out or puts it much, much lower in the abdomen. So then when you do that, your belly button, remember it was attached to the muscles below, it's still in the muscles. We pop it out into a new position and put it into the skin in a beautiful, natural way. So 3 things with a tummy tuck: skin removal, muscle tightening, and belly button repositioning. Now, you can do all of those things, or you can do only a limited number of them. So the key thing here is sometimes you can do a tummy tuck without tightening those abdominal muscles because someone might need it. Now the reality is, in almost every single case that I do a tummy tuck, if I'm there, I'm gonna tighten those muscles together because who doesn't want a tighter abdomen? What would you do?